It's good to have you back. This is the South African Morning. So the coronavirus can be transmitted from humans to animals, and this according to a research conducted by the University of Pretoria. It was probing how the Delta variant was transmitted from humans to animals at a private zoo in Johannesburg, and the study is a first for the African continent. So we're about to get into it through this discussion with a medical virologist and lead researcher on this study, Professor Maritjie Venter. Thank you for your time, Prof, and good morning to you. Quite an interesting research that you have conducted here. Take us through what you have found, particularly between pets and humans, where the Delta variant and COVID-19 is concerned, and transmission, of course.
Good morning, Tomato. Good morning to your listeners. So this specific study was done in a private zoo, or at a private zoo in Johannesburg. So we were contacted by the zoo in June this year to tell us that they had 3 lions with respiratory signs. So the lions had was coughing, had stuffy noses and difficult breathing, and the one lioness actually developed pneumonia, and so she was not responding to antibiotics. And then the veterinarian at the veterinary school at University of Pretoria, Professor Katja Kuppel, and her team went out and they sampled the lions, and then they bring it to our lab at the medical school, and we tested it for COVID-19, and all 3 of the lions tested positive. So then the next day we went with the zoo, and they identified people that they knew had some contact, so through occupational exposure, feeding the lions or looking after the or cleaning their cages and so on. And so we sampled 12 people, and one of them then tested positive. He was asymptomatic at that time, but the next day he developed symptoms. So we sequenced in all of the genomes, and all 3 of the lions and this person had the Delta variant. Another person also tested positive later, but he had a different strain, while these people all had the same, or the person and the lions had the same strain. And it turned out that he was the big cat keeper. So his job was to feed the lions and also to clean their cages. The lions were also in 2 different cages, and so he probably infected the one, and then it was transmitted to the other cage by a person, because the lions weren't in contact. And then it's unclear if the other 2 lions infected each other. They were then treated with dexamethasone, the same as people, and recovered completely. We needed to go back because the zoo was placed under quarantine, so we kept testing them, and they tested positive for about 7 weeks. In the end of this period, it's probably not virus, it's just RNA that they still test positive for. But the concern is then, in such a long time, if you don't know that it's COVID-19, that it could potentially then transmit to other animals. And then specifically in a zoo setting, there's endangered species in a zoo, and you don't want it to be transmitted to other animals. But it's possible to contain it, so the worry is if it should get into wild animals, so if it gets into the wild, that it can spread there and then, establish itself in the wildlife, and potentially then, develop new variants that can then maybe spread on to humans or other animals.
Right. Prof, if I could just jump in there due to time, because you'd conducted this research at a private zoo, did your research explore the transmission from animals to humans? Because we know there are caregivers and some vets there that do take care of the animals at the zoo. Have you explored whether or not some of the transmissions may have come from the animals to humans?
So the timeline, it was more likely that it probably came from the human to the animals. We think that the risk is relatively low from animals to humans, but it's not studied very well. So like you said, our study was the only one in Africa, and it's really important that we increase the surveillance in animals and, and investigate this. So we think that the Delta variant probably became more virulent than the initial strains. There was reports of a tiger right in the beginning of the outbreak or the pandemic in the Bronx Zoo, but those cases were mild, while the Delta variant was also detected in lions in India, and one of those lions died. So it's important that we realize that the feline family, so including domestic cats, are actually sensitive for infection. So if a family at home has COVID, it's important actually not to cuddle with your animals. But if they do show any clinical signs, mostly, as we understand, it is mild in animals, and they also clear the infection, just like humans. So it doesn't become chronic in them. It's not necessary at all to get rid of them, but just watch them. Try to keep them in your property, and then also, if they do become more sick, contact your vet and inform the vet that you and your family had COVID, so that they understand that there's a potential risk for them as well. But they can then, investigate the case and see potentially if, like our lion, if they're really more severe, that they can be treated with something like dexamethasone, which is very commonly used in veterinary practice.
Just before then, I'll let you go, because you're giving advice in terms of, households and pets in this context. What happens then when a pet owner wants to end isolation for the pet? How do I know that this is the right time to end the isolation so that the dog can, or the cat or whatever pet that you have in the home can now be in contact with other people?
So in general, they will also show clinical signs, and if there's no clinical signs, and by the period that you ended your isolation, it should be similar to the pet. You can investigate it further. In general, it's not necessary to test pets if they only had mild symptoms, but if it is more severe, contact your vet, and they can be in contact with us or with Johannesburg Veterinary Research Institute as well. Yeah.
All right. Thank you so much, Professor Maritjie Venter. Thank you for your time this morning and sharing this very interesting, a first for Africa, research that has found that, COVID can be spread and transmitted from humans to animals, of course, as per research conducted at a private zoo right here.